Hello and welcome back to GP Video Podcast by Nadia. So today in this short video podcast, I would be talking about 3 points regarding breast cancer screening. I've already spoken about other points like obesity and its link to breast cancer, but today I would be talking about 3 brief points. Number one is how can you calculate the risk of breast cancer for yourself sitting at home. So there are so many risk calculators there, but there is one which is actually highly recommended by RACGP, and it's called I Prevent by Peter McCallum. So if you Google and just put it there, I Prevent Peter Mac, and that would be the first hit on like the first search thing. So you can calculate your risk by that. It might take you 30 minutes or so. And if you are not comfortable doing that, you can do it with your GP. But that will give you your individualized risk for breast cancer, whether you're average risk, moderate risk and high risk, and that will actually tell you as to when should you start screening for breast cancer. What is screening? Screening is the form of secondary prevention, which means that you have no symptoms, but you are getting tested for a screening, or you are just getting a screening tool to detect something as early as possible so we can prevent it from spreading. And especially screening is done for different cancers, for cardiovascular conditions, for other disease conditions. So there is a difference between screening and testing. Screening is a test that you get when you have no symptom, but you have the risk factors for it. Testing, the actual testing, is when you have the symptoms and then you get the proper tests for diagnosis. So there is a difference there, but both of them. So for example, in breast cancer screening, you get mammograms or ultrasound scans. While in breast cancer testing, when you have the symptom, then you get clinical examination, you get scans like mammogram, ultrasound scans, and number three is tissue biopsy. So that is different from breast cancer screening. So anyways, I've told you that where you can get your own personalized score or risk score is I Prevent Peter Mac. Number two is the family history of breast cancer. When we talk about the family history, uh, it's not only the breast cancer. We should be also asking about ovarian cancer, prostate cancer, pancreatic cancer, and gene mutations. So if somebody in your family has ovarian cancer, that is actually also regarded as the risk factor for developing breast cancer. So ovarian cancer family history is important, as that is also a risk factor for developing breast cancer for you. Number three is I've already spoken about obesity, but smoking, alcohol, and sedentary lifestyle or not exercising are also the modifiable risk factors for breast cancer. So smoking, alcohol, and what is it? The third one? The third one is lack of exercise are also very important modifiable risk factors for breast cancer. These were the messages for today.